How often should your child see a dentist? I made a video all about how often adults should see a dentist. That one is more nuanced. Not everyone needs to go to the dentist every 6 months. Some people need to go more, some people need to go less. I will link that video in the video description below. I'm gonna make this video really simple. Every 6 months. That's how often your kid should see a dentist, at least until the age of 18. A lot is changing with your child's teeth during those years. Teeth are falling out, teeth are coming in, their face is growing and changing, shape, believe it or not. A lot of activity. You want to monitor things, make sure growth and development is on track. Teeth are showing up when they are supposed to. Probably stay on that schedule after that if they're not the most responsible young adult. If they have their life more or less together at 18 somehow, don't have any dental problems, they might be okay to stretch it out, not go to the dentist as often. But from age 1 to 18, I feel confident in saying they should be going every 6 months, all right? That's important. You can stop watching the video now. That's it. You got the message, right? You understand. I'm going to link to a policy paper in the video description. That means video description. That paper is from the American Academy of Pediatric Dentistry. Discusses how frequently kids should see the dentist. So if you don't believe me and what I'm saying right now, you can go read that and see if I'm lying. And if you don't believe that, you can go consult a more conspiratorial dental YouTube channel. Mine's already pretty conspiratorial, but I'm sure there are more conspiratorial ones out there that you could find and enjoy, if that's what you're into, is conspiratorial dental YouTube channels. Let's talk about why. Why take your kid to the dentist every 6 months, starting at age 1? Why is that a good idea? The first time you take a child to the dentist is generally when their first tooth erupts, but no later than 1 year old. Yes, erupts. Teeth erupt. That sounds a little melodramatic, but I don't know, that's what we call it. Now, some kids are born with teeth. Does that mean you gotta rush them to the dental office immediately? He's born with a tooth, we gotta get to a dental office. No, that's all right. Basically, get them there for the first time by around their first birthday, okay? Age 1, very young. Your kid's probably not even forming memories yet. I don't know much about child psychology, but I don't think I remember anything from age 1, as far as I know. Why are we going to the dentist at this age? Well, unless you're obsessively watching all of my YouTube videos and reading my blog posts, it's probably good to have a dentist talk to you about how to keep your kid healthy, right? Teeth are coming into their mouth. Baby teeth are important for the growth and development of the jaws and face. They hold space for the permanent teeth to come into place, and they really do affect how your face is shaped over time. So we want to make sure that we're taking care of the baby teeth. Secondly, we want to start getting your kid used to being at a dental office, right? The more contact they have with handsy dental freaks like myself, I probably didn't need to phrase it that way, but anyway, but the more they see people like me, hopefully the more comfortable they become around us, and the easier time they will have at dental appointments later in life, right? You've heard of, exposure therapy, cognitive behavior therapy. We want your kids to be familiar with the dental environment so it's not scary, right? It's exposure therapy, cognitive behavior therapy for the young, right? Face what you're afraid of, you barely conscious 1-year-old creature that you are. It's also good for you to have an established relationship with a dental provider in case any accidents happen, right? Kids are wild, they run around and hit their faces into things. It'd be nice to know, where you're taking them, not having to scramble as much about, who to communicate with, about, what to do, if they have some kind of a tooth damaging accident as a youngin', right? You have an established place to get care for them. If you have any questions about breastfeeding versus bottle feeding, teething, pacifiers, thumb sucking, baby bottle tooth decay, I address each of those in the blog post linked in the video description, but these are all things that you can discuss further with your own dental provider if you get your child established with them from an early age. Get more targeted advice for you and your child specifically. I don't have kids, but if I did, I personally would take them to a pediatric dentist. I am not a pediatric dentist. I do see young kids, as young as 1. Am I great at it? Nah, I'm fine. I haven't really had too many kids freak out at me over the years. I haven't inflicted any irreparable trauma as far as I know. People like me, dentists like me, I'm better than not seeing a dentist at all, that's for sure. But if you can, I'd recommend seeing a pediatric dentist. They are specialists in seeing children. They have extra training in child behavioral management, as well as advanced training in performing procedures for kids. They see kids constantly every day. At least until you know that your kid is comfortable in a dental office, I would see a pediatric dentist to help them get to that point. Just my 2 cents. I think it'll go smoother for you and them. Not that there aren't lots of excellent general dentists out there who are fantastic with kids. There certainly are, not poo-pooing anyone else. For most kids, having fluoride treatments at regular dental visits is smart. It's an extra measure to protect against cavities. I have other videos on my channel that will teach you everything you need to know about preventing cavities for your kids. Honestly, no one ever has to get a cavity, right? You can watch those videos, never have to worry about cavities at the dentist, but fluoride is generally smart for kids most of the time. It's a good protective measure. So, I mean, I know all of this is old hat and you're a super parent who is going to flawlessly brush and floss your child's teeth every night and also never give them carbohydrate-rich or sugary snacks that cause cavities. But even so, if any cavities do start, it's nice for a dentist to catch them early because it's a lot easier for a cavity to get to the center of a baby tooth than it is for a cavity to get to the center of an adult tooth. The nerves on baby teeth are closer to the surface of the tooth, so small cavities can cause big problems for kids, right? It's better to do a tiny filling on a baby tooth than have to sedate a child for a root canal and crown on a baby tooth. Prevention is best, but early monitoring and minor intervention is second best. So checking in every 6 months helps catch problems early and avoid major procedures. You don't want your child to lose their baby teeth early because of cavities. This can cause a loss of space for the permanent teeth and alter jaw growth, crowding the adult teeth and altering facial structure. We don't want that. Other milestone dental appointments for kids, around age 6, the adult first molars come in. These are some of the most important teeth in the mouth. We do the majority of our chewing with these teeth. These teeth protect our front teeth from excessive chewing forces throughout our lives. You really want to protect the first molars. You want to have your dentist put sealants on these teeth for your kids. Okay, what are sealants, dude? What's that? The molars often have deeper grooves in them that can't be fully cleaned out by a toothbrush. Darn those toothbrushes, they're not perfect. It's one of the most common places in the mouth to get cavities. So you put a sealant and it's like weatherproofing your deck against rain, right? It keeps cavities out of the grooves on these back teeth. So age 6, sealants on the first molars. Around age 7 is also an important time to check in with a dentist. If your child has crowded baby teeth or a deep overbite or overjet where the upper teeth stick forward compared to the lower teeth, or an underbite where the lower teeth stick forward compared to the upper teeth, these are all problems that an orthodontist can help correct as your child is growing. We want to take advantage of that growth. So age 7, great time to check in with an orthodontist to see how your child's teeth are fitting in and how their jaw and face are growing. If things aren't lining up how we would like, an orthodontist can influence the growth of your child's face to help make more room for the teeth. They can also position the teeth to correct an overbite. These things can be accomplished in harmony with a child's growth, which is why it's important to do when a child is still growing, rather than waiting for them to get older. It can lessen the need for longer, more involved orthodontic treatment later in life, and believe it or not, we're starting to get some evidence that it can actually change the way your child's face grows. I'll probably make a separate video about that. There's a book you can look up called Jaws. I'll link that in the video description, and I'll probably make a video about it at some point that talks about behavior management to modify growth of the human face throughout childhood and adolescence. It's pretty interesting. The scientific evidence is not completely definitive at this point by any means, but definitely interesting. So we call orthodontic treatment before all of the teeth are in phase 1 orthodontics. So sometimes this involves braces, other times it requires something called a palatal expander or possibly headgear wear at night. So that happens before, your child loses all of their baby teeth. Around age 11 or 12, your adolescent will get in their second molars. These are another set of back teeth that can have deep grooves in them that are more likely to get cavities. So usually time to get them in for another round of dental sealants to avoid future cavities. Usually around age 12 or so, a child will at this point have all of their permanent teeth in. If they still want to straighten their teeth more or they have bite issues to correct, this would be the time for what we call phase 2 orthodontics. That involves traditional braces or sometimes wearing clear aligners. Be warned though, teenagers are notorious for not being compliant enough in wearing clear aligners consistently, and they will not work if you don't use them all day and all night. All day, all night, we stay up and we stay on. Any Moon Taxi fans? Come on. Huh? Nobody. All right. Teenagers also need excellent oral hygiene to avoid getting cavities while in braces or clear aligners, which is another reason to get healthy habits established from an early age. All right, watch my other YouTube videos. It's way easier for a kid to continue a lifelong habit ingrained from childhood than it is for them to form a new healthy habit as a teenager. I don't know, if you can convince them that, flossing is like a rebel act in defiance of their parents and school administrators and the government, you might have a chance. I don't know. Assuming all of your teens' dental visits have gone well and they have built healthy habits into their life from an early age, they should now have straight teeth with sealants on their molars, no cavities, healthy uninflamed gums. Should be smiling with confidence. It's all good. Everything's good. Nothing's gone wrong. Your kid's a happy kid. I mean, what else matters in a person's life other than their dental health, right? If you get that right, everything else falls into place, right? The last thing the dentist will be monitoring in the teenage years, wisdom teeth, third molars. Some people have room for them and you can keep them. Some people don't and they need to go. I made a video about that you can check out in the video description. If they need to come out, best to do it when you're young. The surgery is much easier, you heal faster. It's just easier if you're young to get your wisdom teeth out. But if you want more details on that and you want a little more nuance about wisdom teeth, made a whole nother video about it, wrote a big blog post about it. You can read all of that. Get super informed about wisdom teeth. I'll mention again that book Jaws that I'm going to link in the video description talks a lot about how, if we had some behavioral modifications as we were growing as children, chances are we really wouldn't need to get our wisdom teeth removed as much as we do in modern times. And they talk about how it isn't really our genetics that have changed, but it's more the environment and the environment gene interactions that we have based on our diet and our breathing patterns. I won't give too much away. Like I said, I'll probably make a different video about the book. But if our children had different habits as they were growing, there is some reasonable evidence that we would not have to take wisdom teeth out as often and we would have more room in our jaws for them. Interesting stuff. I'll make a separate video. Yeah, that pretty well covers it. Feel free to ask questions in the comments. Check out the blog post I wrote in the video description all about stuff you can do to keep your kids' teeth healthy. Lots more detail in there. I don't know, I hope I made a strong enough case for visiting the dentist as a child. You just want it to feel like a routine thing. A lot of the patients I see whose mouths are in rough shape, tell me that their parents never took them to the dentist, right? And I know being a parent is difficult, right? Getting to, not from personal experience, but I mean, it looks hard. Getting to the dentist can be a challenge. I understand. I should mention there is expanded Medicaid coverage for a lot of kids, for dental coverage. I will put a link to the Medicaid website to help with that in the video description. I'm sure you're doing the best you can. Just, getting that reinforcement of what dental health looks like from seeing a hygienist and dentist regularly can help your kid get off, on the right foot to the right start in life. It's just important at a young age, getting that reinforcement of what dental health looks like from seeing a hygienist and dentist regularly. It can just help your kid get off to the right start in life, If nothing else, hopefully these videos can help guide you on how to help keep your kids' teeth healthy at home. Honestly, that's the most important thing, Those healthy daily habits are really our foundation for a strong smile that's gonna last a lifetime. I hope your kids grow up healthy and happy and achieve all of their dreams. Make the world a better place, one smile at a time. That's a nice way to end a video, isn't it?